Welcome back to Act on Mental Health. My name is Sean Hardy, and I'm a licensed mental health counselor based here in Fort Wayne, Indiana. In today's video, we're continuing our series on 100 key points and techniques in acceptance and commitment therapy by looking at how we actually make decisions in practice. ACT isn't a rigid step-by-step manual. It's a flexible, process-based approach. That means therapists are constantly making choices in real time, which process to emphasize, which metaphor to use, and how to respond when clients get stuck. In this part of the series, we'll cover keys 74 through 87, where we'll explore how ACT guides clinical decision-making through principles like process over protocol, function over form, context over content, and values over goals. If you're finding this series helpful, don't forget to like, subscribe, and share so more people can learn about ACT and how to apply it in a meaningful way. So let's get started. One of the first decisions ACT therapists face is whether to follow a strict protocol or to work flexibly with processes. Protocol-driven approaches like manualized treatment plans provide structure and clarity, but they can also risk becoming too rigid, forcing every client into the same mold regardless of their unique context. ACT leans towards a process-based approach. Instead of asking which manual fits this problem, we ask which process of psychological flexibility are most relevant right now. For example, a client struggling with intrusive thoughts may need diffusion work, while another caught in avoidance may need help with willingness and acceptance. This doesn't mean that ACT ignores evidence-based protocols. Manuals can still be helpful guides and provide a safety net for new practitioners. But the heart of ACT is its flexibility, adapting interventions to the client in front of us, not forcing the client in some pre-written script. By prioritizing processes over protocols, ACT ensures that therapy stays dynamic, individualized, and responsive. It keeps us focused on building psychological flexibility in the moment, rather than following a rigid sequence of techniques. Functional analysis is a cornerstone of ACT decision-making. Instead of asking, is this thought true, or is this behavior good or bad, we ask, what function is this serving? For example, consider a client who avoids social events. On the surface, that behavior looks like avoidance of anxiety. But with functional analysis, we look deeper. What is the short-term payoff here? Relief from discomfort. What's the long-term cost? Disconnection, loneliness, and loss of valued relationships. Now, this way of thinking shifts us from content to context. A behavior isn't judged by its appearance. It's evaluated by its consequences and workability. Meaning, is it moving the client toward their values or pulling them away? Functional analysis also helps in session. If a client jokes to deflect from painful material, we can gently explore. I notice humor shows up when things get tough. What's that doing for you? This shines a light on process in real time, helping the client see patterns as they unfold. In ACT, functional analysis isn't just assessment, it's intervention. By helping clients notice the functions of their behaviors, we empower them to make more conscious, values-driven choices. It turns therapy into a laboratory for real-time learning and flexibility. Functional Analytic Psychotherapy, or FAP, is closely related to ACT because it shares the same behavioral roots. While ACT focuses on processes like acceptance, diffusion, and values, FAP emphasizes the therapeutic relationship itself as the primary vehicle for change. The idea is simple but powerful. The way clients relate to the therapist in session often mirrors how they relate to others outside of therapy. In FAP, therapists use in-the-moment observations to shape behavior. If a client avoids eye contact, withdraws emotionally, or struggles with openness, the therapist gently brings attention to that behavior as it happens. They then reinforce more flexibility or authentic behaviors when the client shows them. This creates a live relational laboratory where the new patterns can be learned in real time. For ACT practitioners, FAP offers an important reminder. Change doesn't just happen through exercises and metaphors. It also happens in the therapeutic relationship itself. Noticing avoidance, control, or rigidity in the here and now and responding with acceptance and reinforcements helps clients experience psychological flexibility during the session itself. By blending ACT with FAP, therapists can create a powerful combination of process-based interventions and relational shaping. Together, they help clients not only understand new ways of living, but practice them directly in the room. Another decision-making principle in ACT is to model, initiate, and reinforce the behaviors you want to see in clients. Therapy isn't just talk. It's an active process where the therapist demonstrates flexibility, invites practice, and reinforces progress. Modeling means the therapist embodies ACT processes during the session. If a difficult emotion arises, the therapist might notice it openly and non-judgmentally, showing the client that acceptance is possible. If stuckness shows up, the therapist models diffusion by holding thoughts lightly or using humor appropriately. Clients learn not only through instruction, but by witnessing flexibility in action. Initiating means creating opportunities for experiential practice. Instead of just talking about mindfulness, you guide a present moment exercise. Instead of analyzing values abstractly, you invite the client to reflect on meaningful experiences. This moment moves therapy from theory to lived experience. Reinforcing involves positively acknowledging the client's effort to practice new behaviors, no matter how small. When a client takes a step toward willingness or values-based action, the therapist highlights and celebrates it. Reinforcement strengthens the likelihood that the client will continue experimenting with flexibility outside of therapy. Together, modeling, initiating, and reinforcing creates a cycle of learning. Clients see flexibility, try it themselves, and experience the benefit of being supported when they do. This principle reminds us that ACT is not just about talking differently, it's about living differently, starting right in the therapy room. ACT emphasizes a collaborative stance where therapist and client work in coordination, not opposition. Rather than positioning the therapist as the expert who fixes the client, ACT fosters a partnership where both are engaged in a shared journey of discovery. Promoting coordination means aligning with the client's values, language, and pace. For example, if a client prefers metaphors from sports or nature, the therapist can adapt ACT exercises to fit those themes. If a client struggles with a specific values conflict, the therapist listens deeply and adjusts interventions to meet that reality. This kind of flexibility strengthens trust and engagement. Coordination also involves transparency. ACT therapists often share the model openly with clients as they go, explaining why a certain exercise or metaphor is being used. This demystifies the process and empowers the client to take ownership of their growth. Instead of doing therapy to the client, we're practicing psychological flexibility with them. Another key piece of coordination is pacing. Moving too quickly into difficult material can overwhelm the client, while going too slow can feel unproductive. By tuning into the client's readiness and adjusting accordingly, the therapist helps keep the work challenging but manageable. Ultimately, practitioner-client coordination builds a therapeutic alliance rooted in respect, collaboration, and shared commitment to values. It turns therapy into a cooperative endeavor where growth is co-created. In ACT, change happens through experience, not just conversation. While talking about problems can provide insight, it often reinforces old thinking patterns. That's why ACT emphasizes doing over talking, using experiential exercises, metaphors, and in-session practices to create real shifts. For example, instead of only discussing mindfulness, the therapist might guide a present moment awareness exercise right in session. Instead of only analyzing values, the client might be invited to write down a personal statement or take some sort of symbolic step towards something that they care about. These actions bypass an intellectual debate and allow clients to feel flexibility in their bodies and minds. Doing over talking also means practicing skills during sessions so that clients leave with lived experience, not just abstract ideas. For instance, if a client struggles with diffusion, the therapist might invite them to repeat a thought in a silly voice or sing it out loud. These moments may feel awkward at first, but they create a powerful experiential learning that sticks far longer than discussion alone. This principle also applies outside of therapy. ACT encourages homework framed as life experiments. Small, doable actions that connect directly to values. By trying rather than talking, clients learn what works in real contexts. Talking has its place, but ACT reminds us that action transforms. Doing is what builds flexibility, and doing is what creates change. A central principle in ACT decision-making is to focus on function rather than form. In other words, it's not about what a thought, feeling, or behavior looks like on the surface. It's about what it does. Take two clients who both say, "I need to work harder." For one, this thought may serve as motivation, energizing them to take values-driven steps. For the other, it may function as a whip of self-criticism, leading to exhaustion and avoidance of rest. The form, the words are the same, but the function, what the thought actually produces, is entirely different. When we evaluate function over form, we avoid simplistic judgments like positive versus negative, or healthy versus unhealthy. Instead, we ask, does this move the client toward their values or away from them? By making this the metric, we can respond with precision. This principle also applies to interventions. A mindfulness exercise isn't valuable because of the form it takes. It's valuable if it helps the client contact the present moment with openness. If not, we may need to shift or adapt. Focusing on function keeps ACT flexible. It ensures we're not rigidly attached to techniques or appearances, but always attuned to what actually helps clients live in line with what matters most. In ACT, context trumps content. Content is the what of thoughts and feelings, the specific words, stories, or images in the mind. Context is the how and when, the environment, situation, and relational frames in which those thoughts and feelings show up. For example, the thought, "I'm not good enough," can arise in different contexts. In a job interview, it may lead to avoidance or paralysis. In therapy, when explored with curiosity, it can open space for diffusion and values work. The content is the same, but the context completely changes its impact. Therapists who focus too much on content may get pulled into debating or analyzing the thought itself. Is it true? Where did it come from? In ACT, we step back and notice the context. What happens when you fuse with that thought? How does it influence your behavior? This shift is liberating for clients. They don't need to fix or erase their thoughts. Instead, they can learn to notice the context and choose new responses. For instance, in the context of therapy, "I'm not good enough" becomes an opportunity to practice diffusion, acceptance, and self as context. By prioritizing context over content, ACT helps clients stop wrestling with the details of their minds and start changing how they relate to experience. The question is never, "Is this thought true?" It's always, "Is this thought helpful in this context?" One of ACT's guiding principles is to favor pragmatism over truth. Now let me explain that, because that's kind of a loaded term. We're less interested in whether a thought is factually true and more focused on whether it's helpful. For example, a client might say, "I'll never succeed." And if we chase that truth, we might challenge it with evidence. "But look, you've succeeded before. Look at your job or your education." While that may be accurate, it risks pulling the client into debate with their own mind. Instead, ACT takes a pragmatic stance. What happens when you buy into that thought? Does it move you closer to or further away from your values? This shift is liberating. Clients realize that they don't need to settle debates with their own mind to move forward in life. They can hold thoughts more lightly, choosing actions based on values rather than what their inner stories are technically true. Pragmatism also applies to therapy interventions. We don't ask, "Is this the right technique according to the theory?" but "Is it helping the client build flexibility right now?" If it isn't, we try something else. By emphasizing usefulness over accuracy, ACT helps clients and therapists alike step out of endless debates and into purposeful actions. Many therapies emphasize reduction, reducing symptoms, reducing distress, reducing negative thoughts. ACT, by contrast, works by addition. Instead of asking, "How can we take away suffering?" we ask, What can we add that makes life richer and more flexible? For example, instead of trying to eliminate anxiety, we help clients add willingness, the ability to make room for anxiety and keep living anyways. Instead of reducing rumination, we add diffusion, the skill of noticing thoughts without being dominated by them. Instead of cutting out painful memories, we add selfless context, a sense of self that is broader than any one experience. This additive approach reframes therapy. Clients don't need to wait for symptoms to vanish before they can start living meaningfully. They can begin now by adding processes that expand choice and openness. Working by addition also fosters hope. If therapy is all about subtraction, progress feels like a battle against an endless list of symptoms. But when therapy is about addition, every new skill and values-based action feels like growth, no matter how difficulties remain. By building flexibility through addition, ACT helps clients construct lives that are not free of pain, but full of meaning. In ACT, the focus is not on reducing or even eliminating problem behaviors, but on increasing flexible, values-based behavior. This is a key distinction from many traditional approaches that target symptom reduction as the primary goal. When we aim to reduce behavior like anxiety-driven avoidance or compulsions, we often inadvertently strengthen it. The more we struggle to push something away, the more power it seems to hold. ACT flips this by asking what meaningful behavior can we add to expand life. For instance, rather than reducing avoidance of social gatherings, ACT encourages clients to increase moments of showing up, even if anxiety tags along. Instead of cutting down on rumination, we encourage increasing mindful presence and engagement with valued activities. These additive behaviors gradually shift the client's life toward vitality without putting pressure on symptoms to disappear first. This principle also builds momentum. Clients can measure success not by the absence of distress, but by the presence of meaningful actions. That feels more achievable and inspiring. They don't need to wait for anxiety or sadness to vanish. They can live fully alongside with them. By focusing on increasing behavior, ACT helps clients build richer lives while naturally loosening the grip of unworkable patterns. In ACT, values take precedence over goals. Goals are important, don't get me wrong, but they are outcomes, boxes that we can check off. Values, on the other hand, are ongoing directions, like a compass pointing north. For example, the value of being a loving parent can never be completed. It guides daily actions, like listening patiently, showing up consistently, or creating special moments for my child. A goal might be read to my child 3 nights this week, but the value is the deeper why. When therapy focuses only on goals, clients may become discouraged if goals aren't achieved or if a setback occurs. ACT reorients the work toward values, which remain stable even when goals shift. This keeps clients motivated and grounded in meaning rather than outcome. Values over goals also helps avoid rigidity. Goals can sometimes morph into rules, like I must always succeed, or I must always meet expectations. By keeping values primarily, goals become flexible stepping stones rather than rigid standards. Therapists can use the distinction to reframe clients' struggles. Instead of I failed to achieve my goal, we help clients see I still moved in the direction of my values. That shift creates persistence and resilience. By emphasizing values over goals, ACT empowers clients to live with direction and purpose, even when specific achievements don't go as planned. Values are meant to inspire flexibility, but sometimes they can harden into rigid rules that create new struggles. For example, a client who values being a caring parent might turn that into a rule, like I must never get frustrated with my children. When values become rules, they shift from guiding directions to strict standards that can fuel guilt, shame, or self-criticism. In ACT, therapists help clients notice when this shift is happening. The question becomes, is this value serving as a flexible compass, or has it turned into a rigid rule? For instance, living compassionately means moving toward kindness in many forms, not achieving perfection in any and every interaction. To prevent this drift, therapists can reinforce the idea that values are ongoing directions with no finish line. A compass always points north, but you never arrive at north. You keep moving in that direction. This helps clients hold values lightly and use them as guidance rather than a measuring stick. By ensuring values remain flexible, clients can pursue meaning with persistence and kindness rather than pressure and judgment. Metaphors are one of ACT's most powerful tools, but like any tool, they need to be used thoughtfully. The principle of targeting metaphors reminds us that a metaphor is only effective if it connects with the client's actual struggle. For example, the passengers on the bus exercise is powerful when a client feels like they're overwhelmed by internal voices pulling them off course. But for someone who doesn't connect with that imagery, it may fall flat. In those cases, we adapt, maybe using a sports analogy, a nature metaphor, or even drawing from the client's own world. Targeting metaphors also means introducing them at the right moment. A metaphor used too early may confuse, while one offered in the heat of stuckness can spark insight. Timing matters as much as content. ACT therapists remain flexible, testing whether a metaphor lands and adjusting it if it doesn't. By targeting metaphors to the client's lived experience, we ensure that those stories become bridges to learning rather than distractions. In this video, we've looked at how ACT therapists make decisions in practice. Instead of relying on rigid scripts, ACT encourages flexibility, focusing on function over form, context over content, and values over goals. We've also seen how metaphors, reinforcements, and collaboration help guide moment-to-moment choices in session, ensuring that every intervention moves clients toward greater psychological flexibility. With this, we're almost at the finish line of our series on 100 key points and techniques in ACT. In our next and final video, we'll explore issues within the therapeutic process. This last section will tackle the real-world challenges that come up in therapy, things like therapist self-doubt, client resistance, and common pitfalls that can stall progress. It's a fitting way to wrap up because every therapist knows that practice is never perfect. It's an ongoing process of growth, reflection, and adjustment. So stay tuned for the closing session where we'll bring the full series to a close and reflect on ACT principles that can both support our clients and ourselves as practitioners. Remember, your journey towards a more purposeful and mindful life begins with a single click.